Hello viewers and friends, welcome to another special discussion. Today our guest is another esteemed epidemiologist, Dr. Ramana Dhara. So let me spell it out totally. He's an epidemiologist who had experience of working with CDC, United States of America. Back home, he is with Indian Institute of Public Health. This endemic has become an epidemic, then now it has become a pandemic by the time you understood it. World Health Organization, as we have been putting it across, is the sole organization under the aegis of UN who was supposed to intimate, inform and caution the member countries of their citizens' health. As we have seen, the clear ambiguity, the way they have ignored Taiwan's very clear, with proof, statement that this corona, COVID-19, is happening through human to human way back in December. That was very well ignored. They went by Chinese word, trusting them in the mid-January 2020. And subsequently, before China went for lockdown on January 23rd, prior to that, believing in China's this thing, it went ahead, World Health Organization under the leadership of Director General Dr. Tedros went ahead stating that this is not a human to human transmission. These are all on the record of WHO, please. And subsequently, when China announced lockdown, to their utter surprise, they started to issue new dossiers. So this ambiguity of coming to the rescue of citizens of member countries of WHO, it did not arise. And this confusion has led to thousands of travelers moving out of Wuhan, very well spread across Europe, US, East side Japan, for Australia. So by that time, they could understand, and after duly trusting China, this virus has become a world health emergency, hospitalizing many innocents and killing many, taking away many precious lives. So WHO could not come to the rescue. Even till today, no one is sure as to how this virus is getting transmitted from human to human, in which way, what is the genome factor, what is the strain which is affecting different countries. So for that reason, the vaccine could not be a reality in the very near future, though studies are going on and the big minds, scientific minds are on the job. But before that, what is the best way to overcome this? The best way is prevention. So let me play this audio-visual bite for everyone to understand as to how they can protect themselves from getting affected with this virus. Kindly watch, relax and become knowledgeable.
Hi Iftikhar, how are you?
How are you?
The other day I saw the movie Gully Boy. Did you watch that movie? That movie in which that song is Apna Time Aayega.
Yeah, I have seen that movie, yeah. In which that Alia Bhatt is there.
Yeah, I guess that was selected for Oscar too or not?
Yeah, I don't know about that.
What about your proposal? How
Yeah,
is
it's going.
it?
But now there are some new rules that we have to follow, okay? Because we don't want the virus jumping from one person to another person, okay? And these viruses are very pesky creatures which actually can jump very quickly from people to people and cause disease, okay? So now I will show you a few methods of, preventing this, the virus from jumping from one person to another, okay? The first thing that you have to do really is to stand 3 feet apart. 3 feet is the minimum distance that you stand apart so that your respiratory droplets from your nose or your mouth do not pass to the other person, okay? Also, no handshaking, no hugging now, okay? These are new rules, okay? So the new ways of greeting each other are to do a namaste to each other, or you can do an adab, or you can do an elbow bump, or you can do a foot bump, okay? So now, come on, public health students, show us how you're going to do this.
Namaste. Adab.
Great. Put it in front of your face and cough into it. Or sneeze, okay? And once you're done, what you should do is bunch it up and then put it into a closed dustbin, okay? Now, in case you don't have a tissue on you, what you should do is then cough into your sleeve. And that's the way to cough. Okay? Why is hand washing so very important? Soap and water. Use some alcohol-based hand sanitizers. And the 20 seconds you remember is by singing the happy birthday song. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to you.
Hope, Dr. Garu, this AV is going to be the yardstick, whether it is lockdown or no lockdown, whether you are going to work, the same etiquettes of physical distance, how it is going to help you, and what is that you should do when you cough and sneeze, the cough etiquettes of elbow cough etiquettes as you have suggested, and in principle, washing your hands with soap or alcohol-based sanitizer for 20 seconds. So this has to remain. So welcome to the special discussion, Dr. Garu.
Thank you.
So how do you think that now we should be approaching?
Yeah.
Country after country, lockdown, shutdown,
Right.
infringement of fundamental rights of every citizen,
Yeah.
for no fault of theirs.
Yeah.
Every country failed to understand as to how this was spreading, because this is an imported virus into India. US shut down all the flights at the fag end of January, even before WHO understood. The same Trump travels to India in February, but India still allowed flights from all over the world into India. Happily, the virus being imported, except for thermal screening, nothing was in place. This could have been avoided, because till March 22nd, when Prime Minister announced Janata curfew, subsequently lockdown, and prior to that, March 11th, WHO announces it as a world pandemic.
Yes.
And mind you, viewers, till this day, I think WHO has not pronounced any etiquette on banning the international flights. That is a sordid state of affairs. So March 11th, pandemic declaration by WHO. March 12th, our own Lava Agarwal says it's a local infection. March 19th, even Prime Minister assured, stating that we are completely under control. All of a sudden on March 22nd, Janata curfew, subsequently first lockdown, the second lockdown, now we are in the second lockdown from April 14th. The world is no better. So many deaths in US, so many getting infected across Europe, and state after state in India too. How do you relate this?
Yes. Just to mention a word, that the video that you saw was done before the universal recommendation of wearing masks. So now, of course, we are all, required to wear masks so that the transmission is prevented, as well as transmission from one person to another is prevented. Okay.
More so from the affected ones. If they wear
Yes.
a mask,
Yeah.
they will not allow this spread.
Yeah.
So everyone should become conscious, and it's due diligence, it's their responsibility.
Yes. So we have shown you the basic methods of prevention. Now, what's important is that these methods of prevention can now be implemented in the second phase after the first phase of lockdown. We are now entering the second phase of the lockdown. To give a little history, it's important to remember that infectious disease and contagious diseases are essentially diseases of the poor people. Can they affect the upper middle class and the middle class people? Yes, they can. But it's primarily a disease of poverty and of living conditions. So poor people get more affected by diseases like malaria, like dengue, like tuberculosis, as well as diarrheal diseases. And there is a lot of concern that this COVID-19 can also become ultimately a disease which affects poorer people.
Now it has been imported by all international travelers.
It has been, initially it has been imported
All the
by-
affluent classes.
Yes, it
has
has
become
been-
the carriers now.
Yes, the affluent people have become the carriers.
Yeah.
It turns out that the initial data showed that it's all the travelers from abroad who brought the infection in, not so much the migrant labor and the poor people who were there in India. Right? What did happen is that the migrant labor were not taken care of when the first initial lockdown occurred. So they had to either remain where they were in makeshift camps, or they had to travel long distances back to their homes without much money, without any food. And so they suffered, on this journey back to their homes.
Yeah.
Also, if they were forced to be kept in makeshift camps, the fact is that the virus would continue spreading because of the living conditions in these camps. Likewise, what happens is that in low-income housing, the effects of the lockdown mean that physical distancing is not really possible in these low-income housing. So what happens is, if that people are forced to stay indoors, particularly in family clusters where this disease seems to be spreading much faster, here the kind of proximity, the closeness with each other in these families will encourage the spread of the virus, as opposed to the fact that if these people were outside, there might be less transmission of the virus. So this is one of the unintended effects of the lockdown. It is quite possible that middle and upper middle class people who have better homes and housing, will have more opportunities for physical distancing in their larger homes. Also, they have the economic strength, particularly in the upper middle class, because they can stock up on the necessities to endure during the lockdown, that they can withstand the effects of the lockdown for a longer period of time. Whereas people who are lower income and who lost their jobs are not able to do so, even though the government is providing some level of social security measures, like food and like some money, but this is still nowhere adequate. Problems that exist with staying in the house will not only include things like boredom, conflict, there will be domestic violence, between family members. This has been shown in data. And so,
No country is exception.
no country is an exception.
Developed or
Yes,
developing or
absolutely.
underdeveloped.
Yeah, no country is
It's a
an
human
exception.
psyche.
It's a human psyche.
Yeah.
It can happen amongst the upper middle class, it can happen in middle class, it can happen in poorer people.
Yeah.
However, all of these factors get exaggerated and increased with the lower income people, because their socio-economic conditions are more difficult than those people who have.
And their understanding of the given situation.
Their
is also-
understanding of the given situation is much more difficult. What is important, we have already been through the first phase of the lockdown. Now, in the second phase, the Kerala model has clearly said that in the second phase, there should be a relaxation of the lockdown in specific phases. And these phases will gradually include, for example, the number of cases that are present, the number of homes that are under surveillance, as well as the number of hotspots in each district. And so these criteria can be employed to see which phase can be relaxed at what point in time. So there is a certain scientific method by which these gradual relaxation of the lockdown can be achieved. Okay? With the cautious proviso that in the event that the cases start rising again, we may have to go back into a lockdown phase. Okay?
Yeah, that's understood. It sounds pretty much good. It's a three-tier strategy which Kerala has adopted. Now coming back to, did India trust China so much that even out of our humane reach, some supplies were sent to China also, whether it is masks or kits or to bring back our own people?
Yes.
Because from Kerala, 17 Italians and 3 medicos who have been in Wuhan were the first ones to be affected. And subsequently there was a case from Dubai, who traveled from Dubai, the Bangalore-based software personnel. So you want to say India has trusted, the Prime Minister Modi has trusted China so much that they could not give him any information as to how it was spreading?
Well, there was...
Because we are just a
Yeah.
neighboring country. We are sharing a common border with them.
Yes,
Northeastern
absolutely.
areas specifically.
Yeah. Well, it is an act of goodwill that the Indian government sent these supplies to China, and also that they brought the students back
Yeah.
from Wuhan. So that was an act of goodwill, and also
It
it
has
was
been
necessary.
sent to Italy and everywhere also.
Yes, correct.
But don't you think when they were doing that, at least they could have shared vital information with India, being a neighboring country with such a long border, northeastern border?
Yeah. In the developing phases, there was a certain lack of transparency and information, on the part of China. And this has been commented upon by various institutions as well as international organizations, that they could have been more forthcoming in the data on how the disease spread. In fact, their own doctor, who initially discovered that the COVID-19 case was going on and ultimately died of this condition, was reprimanded, for doing so. So that is an issue, of course, that the Chinese government will have to come to grips with.
No, because why I'm trying to put this across is, Modi being a prime minister, has he become another soft target, as was evidence in the past? Jawaharlal Nehru during that 1962 war. Same, they made us to, China made India to see that it's a trustworthy neighbor, and subsequently you have seen the follow-up 1962 war, how they were trying to, when Nehru was at the helm. Now don't you think now that was a physical war, it's fine. Now it's a different sort of situation. It's a bio-war kind of thing now.
Yeah.
So you mean to say again, Mr. Modi has become another Nehru of 1962, because now it is affecting all Indians. Their
Yeah.
fundamental rights are being suppressed, they are being locked down.
Yeah.
Modi is also not happy. He's not a happy prime minister, because he has to take care of the 1.3 billion populace.
It is a big responsibility, for the Prime Minister.
Yeah.
Let's remember that there was a lot of paucity of information to start with. That India's public health infrastructure needed a lot of development, and it did not exist in India. It was a relatively weak public health infrastructure. Just like, for example, even in the United States, where there is a varied public health infrastructure in the United States, and there is more dependence on the private sector. And of course, the United States has also paid a certain price, for not having a strong public health infrastructure in their own country.
Yeah.
They have, of course, now they have been testing widely, and so therefore the number of cases that they
the
found.
developed countries have 10% spending on public health care. India, not even 1% of the budget.
Yes. So
And some states like Telangana, the chief minister promised multi-specialty hospital for every district and for every constituency 150 bed hospital. Their manifesto. But they could not go ahead. They could construct a separate Pragati Bhavan for himself. But in these 6 years, had he done so, now at least I'm happy that he has converted a Gachibowli stadium into that complex into 1500 bedded hospital. I'm sure, I only hope that it remains the same. And like that, you need many such hospitals in all districts and across India. You mean to say they have faltered on public health care?
yeah, the public health infrastructure in India was weak to start with. Now, let us hope that COVID-19 is going to be a real kick in the pants to kickstart this development of the public health infrastructure, development of modern facilities to help with these kinds of epidemics and pandemics, which I think we can only expect are going to continue, in the future. Yeah.
Then how to, because that also very specific as, because why I had to raise Pandit Jawaharlal Nehru being Prime Minister in 1962, he trusted China and he was totally deceived. Now don't you think the same thing is repeating again?
That is something which I find a little bit difficult to comment upon.
And it's case of only
Yeah.
health, public health. Had they
Yeah.
given us some sufficient information before, we could have gone for this lockdown or shutting down of these international flights, because no information was shared. Because January 23rd, Wuhan and entire China was shut down, literally. But they were allowing flights to and fro, and they were not sharing any information. At least being a friendly neighbor, a responsible neighbor, don't you think we missed that opportunity in the very first instance? To prevent, because India is such a big country next to China, population.
Yeah. Well, the fact is that the initial recommendations were all test as widely as possible. And that's something that the government initially did not want to do. They said, the testing is really not for us. So there was a little catch-up time by the time the government realized that testing has to be done, widely. Now, it's a fundamental principle in infectious disease that the more you test, the more you find. And that's exactly what is going on in all these countries. So, for example, the Southeast Asian countries like Taiwan and South Korea and Hong Kong, without going into lockdown, they aggressively implemented the practices of testing, of contact tracing, and quarantine and isolation after that. And their model has actually turned out to be quite effective. And in very similar ways, even Kerala has done the same thing. So the Kerala model has been actually commended by many organizations and countries as a great way of tackling this particular pandemic.
You pursue it instead of allowing it to come to you.
Yes, exactly.
Because I feel this is why I am asking you. This is where did we fail, or China again failed us in providing that information, so that Indians were sitting with that laid back attitude till March 22nd.
Yeah, now the information is there, so now we have to pursue it very aggressively. And that is really the take-home lesson over here, that we should not necessarily depend on some other country to provide information, but we have the resources. We have intelligent physicians, we have doctors,
wonderful.
We have good scientists.
Yeah.
What we need to do is also get epidemiologists involved in strategy and policy making for tackling these pandemics. And epidemiology is a relatively new science in the Indian context. But it is now vital that epidemiologists must be involved in strategy making and strategy planning, for this country. Because epidemiologists understand the patterns of injuries and illnesses that happen in populations. And they're vital to see how infectious a particular infectious disease is. How one person, how many people do they spread it to, right? As I mentioned about the infectiousness, for example, of tuberculosis versus COVID-19, tuberculosis is actually a more infectious disease, particularly in southern India, as compared to COVID-19. But the thing is that we do have prevention and treatment for tuberculosis, whereas COVID-19 is such a new disease that we do not know what the prevention and treatment, we know something about the prevention at this point in time. There is no vaccine for it, but there is no established treatment for it yet. So that's why it's so much more important to be able to, care for this. We do know, for example, that older people above 60, particularly those with high blood pressure, with diabetes and lung disease and heart disease, are more at risk for the severe effects of COVID-19. However, the good news is that roughly 80% of the population is going to get a relatively mild infection, and they will be able to withstand the infection itself. So there are many people who are actually recovered from this disease. And that's important to remember, so that we don't lose hope with the fact that there is a lot of media attention on COVID-19. But, we should also remember that most of it is going to be relatively mild illness, which can be tackled with simple prevention measures. Okay? What is also important at this point is that after having been through the first lockdown, since we have a method by which we can begin to relax the lockdown in phases, being very guarded about the situation, it's also important to be able to get people back to work. We have to be able to trust people that they understand the severity of this disease, but that they can also get back to work so that they can be economically productive, they can get money so that they can feed themselves and they can feed their family. Let's remember that hunger is an experience that the lower income people,
For that matter, anyone,
anybody,
any human.
anybody, but particularly more so for the lower income people, because hunger is a very immediate
Unless they go out for work, they cannot.
experience for them, and they know that. They know that if they don't make money, they can get hungry.
Yeah.
And hunger itself can lead to malnutrition and therefore reduced immunity and therefore, increased susceptibility to infection. So it's very important that we trust the people to be able to get back to work with all the necessary precautions against COVID-19. So they know that they have to get back to work, but they also know that they're at risk for exposure. So they have to do the personal hygiene and personal cleanliness, the cough etiquette, maintaining physical distancing. We can get them back to work with all these precautions, as well as provide them with the social security protection network, while they're getting back to work. So this will provide them not only with the economic wherewithal to support themselves, but it will also give them hope.
Psychologically, a big
Psychologically, it will be a big boost for them that they are actually able to get back to work and they have the potential for actually going back.
boost. They have that guarded immunity to overcome anything.
Yes, exactly.
With,
So-
of course, with all those protocols in place.
Yeah, with
Cough
protocols.
etiquettes, physical
Yes.
distancing, washing your hands regularly. These are mandatory now. It's a new order of living now in the world.
It's a new order of living and we'll have to come to terms with this. I really hope that our method and our culture of personal hygiene and cleanliness is going to improve with this kick in the pants that Mother Nature has delivered to us.
So you mean to say this will be the order of the day tomorrow?
I am hoping that this will become the order of the day, that we will
And
learn.
it should also.
It should become that. Yes, it should become something that is ingrained in our society from here on, that we are going to keep personal hygiene and cleanliness at the top of the list.
So any word about the frontline doctor fraternity or the nurses
Yes,
and all those hospital staff,
yes.
and including even the journalists like us, we have to go out and cover in a big way. The doctors like you who have been practicing everywhere, and all those, whether the groceries or the other stores who have been trying to come to the rescue of the people in dire straits and need.
Yes. And it is absolutely vital and important that we protect these frontline workers. We of course must protect the doctors and nurses and hospital staff who are attending to the severe cases. They are exposed to the severe COVID cases, and so their level of protection has got to be of an order of magnitude higher than the other people who are also part of the essential working staff. Now, there are people who are providing essential services like electricity, like water, like sewage, telecommunications, food. All of these people also,
Sanitation staff.
sanitation, they also have to be protected, against all these things. And if they get protected, they will actually feel good and they will perform their job with more vigor and with more caution, that they are being protected and they will then provide a good service.
As an
to-
epidemiologist, any piece of advice to states in India, to country as a whole, and almost because you have worked in even CDC, to the world at large?
I think it's important to remember again that the infectious disease is a disease of poor people. So we need to protect them the best that we can with the most scientific and modern methods that are available in modern science. So prevention really at the end of the day is far more important than actually a cure. There is no magic bullet for treating this condition at this point in time. Prevention right now is the primary method of prevention, of tackling this disease. And let's also remember that, as I mentioned, that there is a class differentiation between people who can be under the lockdown situation and can withstand the lockdown for extended periods of time versus the lower income people who are unable to withstand the lockdown for longer periods of time. And so therefore the government really needs to be proactive about taking care of those people and perhaps using this as a method of gradually phasing out the lockdown and phasing in a return to economic activity.
So as an epidemiologist, another, because you have seen flu, every year they have to change the vaccine.
Yes.
So you better understand the COVID-19, maintain all the protocols which can prevent, and then improve yourself, as you rightly said, personal hygiene, or see that you go through the nutritious stuff so that you can avoid these things.
Avoid, yeah. We now know there are roughly about 8 different strains of COVID which are circulating around the different countries of the earth. There is not a significant difference in these strains in terms of the severity of the disease that they can cause.
Yeah.
That is relatively good news in terms of development of a vaccine down the road.
Yeah.
But we are still 12 to 18 months away from development of the vaccine. So we don't know how this virus is going to mutate between now and then.
Yeah.
But clearly the virologists and the vaccine specialists are going to take a look at that. But it's also important to remember that whatever methods of prevention are developed, whether it's a vaccine, whether it's medication, that these prevention and treatment methods are distributed equitably in the population. That all sections of the population, regardless of class and income, will have equitable access to these methods of treatment. And that's the only way that you can prove to the population that you're taking care of that you care for them and that they are going to be safe and healthy.
Yeah. This is, for this discussion today, our epidemiologist has very clearly spelled out as to what we should be doing. Whether it is class or mass, COVID-19 or corona is one and the same. So understanding the disease as to how this is spreading is more important, which allows you to prevent from getting affected individually yourself, then your family, your society, your state, your country. So if you can follow these etiquettes, which again let me play this audio visual, which would really help you to understand. You have to understand that this was done much before, so there are no masks in that. So now we are wearing masks to make you to understand. Mask yourself and go through this AV. Now it is very clear that, as has been done in 1962, Prime Minister Modi, though had got very good bilateral understanding with the Chinese premier, but what really mystifies everyone is that China, be having such a long northeastern border with India, did not share the Wuhan tragic corona COVID-19 as to how it was spreading and what were the measures they have initiated to control, why they went for total shutdown in the very beginning itself, and after that now they say they are slowly but surely releasing, and how Beijing, Shanghai and all the other cities were not affected. They did not share, as was done in 1962 with Pandit Jawaharlal Nehru, erstwhile Prime Minister, that time Prime Minister of India. The same thing happened with Prime Minister Modi. So how trustworthy our neighbor China is, it is for everyone to understand. At least now Prime Minister, Chief Ministers and all the administrators should start trusting their own Indian public, make them aware, kindly invest all the information, necessary information in the public domain so that each and every Indian citizen is aware of what government at the central level or at the union level or at the state level they are doing to control the spread and to mitigate the sufferings, economical and even psychological aspects also. Until and unless you keep people informed, because people are at risk, they should be informed right from village setback, because this is the harvesting season, till the semi-urban, urban areas, all should be informed, and how well, how fast they can get back to their respective occupations. Of course, you have to follow these protocols, come whatever may, to prevent yourself from really getting affected. Keeping all these things in mind, I hope every citizen, whether it's Indian or otherwise in the world over, they would understand and see to that this corona COVID-19 spread is arrested at the earliest so that we can get back to our normal life. Of course, with physical distance norms, cough etiquettes in place, wash your hands with soap or alcohol-based sanitizer, and never try to shake hands. Keep this in your mind. Always say namaste, adab, or hello. So with this, we are going to wind up this special discussion. See you soon with another discussion with another guest. This is Dr. Tangella Shivaprasad Reddy alias Dr. TSPR saying bye to you.
Hi, Iftikhar. How
Hi,
are you?
Anisha, how are you?
The other day I saw the movie Gully Boy. Did you watch that movie? And that movie in which that song is Apna Time Aayega.
Yeah, I have seen that movie, yeah. In which that Alia Bhatt is there.
Yeah, I guess that was selected for Oscar too or not.
Yeah, I don't know about that.
What about a proposal? How
Yeah,
is
it's
it?
going. Yeah.
Okay.
But now there are some new rules that we have to follow, okay? Because we don't want the virus jumping from one person to another person, okay? And these viruses are very pesky creatures which actually can jump very quickly from people to people and cause disease, okay? So now I will show you a few methods of, preventing this, the virus from jumping from one person to another, okay? The first thing that you have to do really is to stand 3 feet apart. 3 feet is the minimum distance that you stand apart so that your respiratory droplets from your nose or your mouth do not pass to the other person, okay? Also, no handshaking, no hugging now, okay? These are new rules, okay? So the new ways of greeting each other are to do a namaste to each other, or you can do an adab, or you can do an elbow bump, or you can do a foot bump, okay? So now, come on, public health students, show us how you're going to do this.
Namaste. Adab.
Great. Put it in front of your face and cough into it. Or sneeze, okay? And once you're done, what you should do is bunch it up and then put it into a closed dustbin, okay? Now, in case you don't have a tissue on you, what you should do is then cough into your sleeve. And that's the way to cough. Okay? Why is hand washing so very important? Soap and water. Use some alcohol-based hand sanitizers. And the 20 seconds you remember is by singing the happy birthday song. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to you.